Sculptor, and we are doing a male nipple reduction. Come on in. Let's take a look at our patient here. Basically, this is the central nipple. It's a little bit too tall. It gets basically, patients complain about it being irritating. It rubs up against clothing. Also, it kind of shows through on a shirt and has those little pointy looks, especially when it's kind of colder and more erect like it is. Basically, what we do is we're going to reduce it so that it doesn't protrude as much. There's lots of different ways to do it. Obviously, you can just imagine the most elementary way is we just cut it off completely, just snip it off and cauterize the middle and let it heal and scab over. That usually is unpredictable in the way it heals. It usually doesn't look as natural. Other ways to do it, a fish mouth thing, or basically carving out the middle and then kind of closing it like a fish mouth and removing the middle part. Sometimes that also doesn't heal well because you have a suture line right across the middle. The most elegant way that I find to do it is what I call kind of a mushroom flap lay down technique. It's a little more elegant and a little more complicated to do. I'm going to show you here. We kind of did most of the dissection here. So we're basically going to save his the tip of his nipple. We're only going to save about 10%. 90% of the nipple we're actually going to take away. We're going to leave that attached to a little stalk. I basically did my dissection already, so I'm just going to complete my dissection here. Basically, I am removing 90% of his nipple. That's most of the nipple here. I saved the tip. I don't know if you can see that real well. When I save the tip, that means the blood vessels and the nerves all are going into that tip. We're saving the skin, and when I lay it down into the defect, it basically looks like that. When we put the sutures in, they're dissolvable. There's all gonna be almost no scar. You won't be able to tell that anything was done. Come in closer. Here's the before. Here is the after. That's nipple reduction, a little more elegant way of doing it. I'm Dr. T in Chicago. You have a nipple that protrudes out a little bit taller than you like and it irritates you, come see me in Chicago. I also do this for female nipple reductions as well for post breastfeeding, where nipple atrophy, hypertrophy. All right, see you guys.